UK's biggest trade union says ambulance workers intend to join nurses in taking strike action before Christmas. UNISON says thousands of paramedics and emergency call handlers have voted in favour of doing so, but an exact date has not been set. Joining us now is Sara Gorton, UNISON's Head of Health. Hi, Sarah, it's good to see you. Thanks for joining us. When are the strikes going to be?
Well, we're just looking at the results at the moment, but we're expecting around 20,000 health workers to be called in this first batch of industrial action before Christmas. So that covers a range of different healthcare occupations. We've got membership across all of the non-medical groups in the NHS. But what you'll be most aware of is the large number of ambulance workers that will be involved in this first wave. So we're looking at dates before Christmas. We haven't set those yet. And the key message this morning is to use this as an opportunity, again, to say to the government, we can postpone this if you come forward and boost pay and talk to us about resolving the staffing crisis that's running rife across the NHS.
Are you considering coordinating with the nurses' strike?
So we have a very good relationship with all of the NHS trade unions, and we will be talking about coordination with all of those that get industrial action mandates. So I think you've covered in previous interviews, we're expecting other groups of healthcare workers to return their ballot results over the coming days and weeks. So this could see different occupational groups join over the course of the winter, all with one clear message that the government really needs to engage with trade unions to talk to us about how to invest in the workforce of the NHS. Otherwise, the 7 million of us waiting for treatment, is just going to get a bigger and bigger number, and more people are going to leave the NHS for better paid and less stressful work elsewhere.
But are you going to coordinate with the nurses? Because if you are, of course, the first nurses' strike is scheduled for the 15th of December, so you'll have to notify the government tomorrow, won't you? Because you need a fortnight's notice, don't you?
That's right. There are really stringent laws in place about the kind of notice that we have to give to employers. So as you can imagine, those conversations are going on in the background, and we'll be having those today. So we need to decide pretty quickly what the first batch of action will look like. But the bigger message is that this is only going to build. So yesterday's results for UNISON were that over 80,000 people said that they were prepared in the middle of the worst cost of living crisis. 80,000 people prepared to go without pay in order to call the government's attention to the dire state of pay and staffing in the NHS. And that is just going to build as we go through the winter and into next year. So the government really need to stop ignoring this, to stop pretending that they've engaged properly with this subject, when instead they've just ignored it and referred it to the NHS pay review body. They've outsourced this problem, if you will. They need to engage with us. Look north across the border.
Sarah, if I may, let me just hop in there, because you brought up the figure of 80,000 UNISON members voting to strike, but that's out of 350,000 that were balloted.
So in England, our ballot was of 280,000 members. I think the bigger number is the figure across the whole of the UK. So, and as you know, we have to meet very, very stringent targets and to get industrial action mandates. So we balloted around 280,000 health workers in England. Average turnout was around 35%, so falling just short of the 50% needed in many workplaces.
I'm not very good at maths, but I know 35% and 50% is not just short.
Well, we had a large number of organisations where we were very, very close. So we'll need to make some quick decisions about what happens in those. But we know there's roughly about 20,000 people covered by the action that we are going to be calling before Christmas. But the message is really clear. We've got the example of what's happened in Scotland, where politicians have made a choice to boost pay. So the pay offer that's under consideration in Scotland is over £800 greater per person than what health workers have been awarded in England. So there is a clear political choice here. We're asking the government to take that choice and to talk to us to try and reverse the terrible staffing crisis that's engulfing the NHS.
Sarah, 80,000 people voted to strike out of, even with your numbers, 280,000. That means 200,000 who were balloted did not vote to strike. 50% turnout threshold was met in just 8 of 200 employers, and yet you're asking your members to come out on strike and potentially join with the nurses to strike at the same time, causing absolute mayhem in the National Health Service. Do you feel those figures back that up?
Absolutely. So where we have got mandates, if you look at the vote split, so of those people who voted, 80–90% in all of the different employers voting for strike action. We have really restrictive trade union laws in the UK, so there are a range of factors for not meeting the threshold everywhere. But we are really assured that the industrial action will be well supported in those places. Not just by members, but we know that the public, the support action by health workers, support better investment in NHS staffing in order to give us the health service that we all deserve, and to make sure
meeting
that
the threshold everywhere, Sarah, but it was 8 out of 200 employers is where you met the threshold.
Yeah, that's right. That's right, and we will be.
You're comfortable with calling people out on strike, and we're only 8 out of 200 employers, 280,000 ballot papers sent out, only 80,000 voting in favour of strike, and you're comfortable with those numbers.
So it was 80,000 people that returned their ballot papers. So we have a very arcane system in the in industrial law where we have to run all of our ballots by post. So people cannot vote online as they do in other elections. We're not allowed to go into workplaces and run secure ballots there. People have to wait to get a ballot paper through to their home address, and then they have to send those ballot papers back. So we had over 80,000 people that actually took that action, which I think sends a really strong message to the government about the strength of feeling of NHS workers.
OK, unfortunately, we are out of time, so we are going to have to leave it there. We've got to ask the trade union leaders tomorrow, if you'd like to come and join us for that, to answer some questions from members of the public. We would be absolutely thrilled to see you, Sarah. I'll get one of the team to get in touch with you and see where we go with that. Tomorrow's Take at the top of the next hour. Do stay tuned our way here on Sky.